advocate Bonnie Currie Gwamo is a force to be reckoned with and has led the DNA task team and the TCC centres in South Africa like none other. Also a lawyer, a specialist High Court litigator with 24 years of prosecutorial expertise. Her focus lies on the prosecution and management of gender-based violence and femicide in South Africa, and she has a particular emphasis on vulnerable groups, child murders, femicide, child pornography, serial rapists, child justice. Bonnie, I don't know how you get up in the morning, given what you have to deal with specifically in this country. Bonnie has honestly the most comprehensive knowledge and experience in these critical matters, and really is a leading authority in the field. She's currently serving as the National Head of the Sexual Offences and Community Affairs Unit within the South African National Prosecuting Authority, and is responsible for driving the GBV mandate, and will be talking to us today about some of the initiatives that she has put together in South Africa, a survivor-centered approach, as well as we hear about the DNA backlog. And let me tell you, this lady is at the center of it, and really has some insight and knowledge into how to ensure that we are looking to prevent tomorrow's victims by identifying these serial perpetrators at an early stage of their criminal career. Bonnie, thank you again for joining us. I used to be terrified of you, and then when I traveled with her to Dar es Salaam, we had a moment in the airport where she was feeling a little bit unwell, and I just handed her my bottle of water and I said, just drink this. And I think that we just became sisters after that. It was like, I'm not scared of you anymore because I know you. So thank you for sharing your knowledge, and over to you. Thank you.
Thank you, Vanessa, and thank you for once again inviting me to this session. I wasn't feeling very well last week. I'm a diabetic and I'm not a very good one at it. So sometimes the sugar levels shoot up. But I'm grateful to be here today. And I'll start off with the reminder that I am not a scientist. I'm a prosecutor, a very proud one, indeed, in a country such as ours. So the unit that I head up, okay, the green button, I'm assuming. The unit that I head up is called the Sexual Offences and Community Affairs Unit, just colloquially known as soccer. Do not confuse it with any football club or anything else. And we are a specialized unit responsible for the GBV mandate of the National Prosecuting Authority. And one of our key activities is formulation and implementation of best practices in addressing GBVF and optimal management of GBVF matters. Now, I need not tell any of you about the scourge of GBV globally, and I do not think I need to speak about GBV in South Africa. It is completely out of control. And because of this, the President of South Africa introduced the Gender-Based Violence and Femicide National Strategic Plan, also called the NSP for short. And this NSP sets out to address the systemic challenges that have resulted in the inadequate response to the management of GBVF cases. Now, what is that inadequate response? There's a reason that victims are not reporting. We know GBV is high, but if you look at our numbers, you know, there is a disconnect between the numbers of cases reported versus what's happening on the ground. We are all aware of that, whether you're from the police, whether you the scientist, whoever you are. And it's not just a South African phenomenon, it is worldwide, that is the case. So to give effect to our own obligations, we need to ensure optimal management of these GBV cases. And so what does optimal management of GBV cases look like? For me, it means there must be adequate access to report GBV. You cannot have in place all the most brilliant systems and you don't have adequate access the victim does not have adequate access to report GBV. There should be adequate pre-trial services available to the victim. I was a prosecutor, well, I am a prosecutor, right? But I was a litigator in the High Court in the Western Cape for 24 years. It's a long time. And I can tell you now, the focus was never on pre-trial services. It was on the trial. It was on getting that conviction. And somewhere along the line, we miss the victim sometimes. And so for me, there must be adequate pre-trial services available to the victim. There needs to be PGI, prosecutor-guided investigation, and prosecution by specialist prosecutors and advocates. There must be an adequately informed community on issues relating to GBV, because we know one of the reasons people are not reporting is that they often do not know what GBV is. Those of us sitting here, we know what GBV is. We work with it all the time. But in our communities where GBV is rife, I cannot report something if I don't know that I'm a victim, if I don't know my rights. So if we say there's optimal management of a GBV matter, we need to make sure that the community we serve is adequately apprised around all issues relating to GBV, including their rights. There must be adequate procedures in place for the proper collection of evidence and adequate forensic resources available to analyze the collected evidence. The latter two, of course, very relevant to this particular symposium, DNA, because we all know that DNA is often what stands between a conviction and an acquittal in a GBV matter. So that for me is what optimal management of GBV matter should look like. I'm sure there will be those of you that might add some of it, and I would like to, when we have the question time, to also hear from the floor whether you agree that this is what is required for optimal management of GBV. So in South Africa, we introduced a best practice called Tutuzela Care Center model. And it is the soccer unit that I head up that has the mandate to develop best practices and policies for optimal management of GBV cases. And so one of the best practices is the TCC model. It's called TCC, short Tutuzela Care Center. Tutuzela meaning comfort, a place of comfort. And this was introduced in the year 2001. And to date, we have 63 of these centers across the country. We have them in rural, urban, peri-urban areas so that we are able to reach as many victims as possible. But I can tell you now, 63 simply isn't enough. This is a huge country. And so the 63 that we have should actually probably be doubled to really have a huge impact. But I must just say to you that in the past 2 years, we've added 8 new TCCs. So we are going at a very fast pace at the moment to try and really increase that TCC footprint across the country. So why are these TCCs so important? They are one-stop facilities, which initially it was introduced as an anti-rape strategy, but it was expanded in 2021, to now provide services for all GBV offenses. Because we found that even the victim of sexual offenses who arrives at the TCC is actually a victim of assault, of violent assault. Victims were arriving there with no history of sexual assault, only violent assault, and they were still being helped, right? But so we thought, let us make it, confirm it, that we do assist all victims of GBV. And why? What it's aimed at is reducing secondary victimization. That's one of the key reasons victims simply don't report, is because of that secondary victimization. It's aimed at increasing the conviction rate by building a case which is ready for successful prosecution and reducing the cycle times from time it's reported until finalization. And so the TCCs are managed by the NPA, but in partnership with other relevant stakeholders such as the Department of Health, the police, and the Department of Social Development. So why do TCCs work? They work because they're victim-centered. I don't think you can address GBV if what you're putting in place, if your intervention is not victim-centered. The services are tailored to the needs of that particular victim and to reduce secondary victimization. So the space that is created, the environment which is created within the TCC must be an environment which is victim-friendly and conducive to reporting. And that's very important. So what we've said is you don't need to necessarily go to the police station. At most of our TCCs, we have police right there. So you can come straight and come to that safe environment at the Tutuzela Care Center. So you don't go to an overfull police station. You're not then amongst all the other persons who are either reporting or potentially even perpetrators at a police station. Because you can imagine how daunting it must be to go into that environment and you've just been violated yourself. So through collaboration with the police, we have been able to now create an environment where the victim can come straight into the center itself and come and report their case. And dockets are opened at the Tutuzela Care Center, obviously by the police, and then it is filtered through to the police station that has the necessary jurisdiction. The second one that is very important is that it's court-directed. So Tutuzela centers are court-directed, and this distinguishes Tutuzela Care Centers from other centers that are set up, because there are many other centers that are set up to assist victims of GBV in South Africa. But what sets us apart is that we are court-directed. So the offender accountability is ensured. So what we do is we train specialized personnel at the Tutuzela Care Center to come in. Sorry, my eyesight is going here. Apologies, this is now age showing. Okay, so we have trained personnel specializing in dealing with victims and survivors at all points of service within the center. We secure the physical, forensic, and other evidence of the victim and the survivor, and have a focused prosecutor-guided investigation. The third leg that makes it so workable and such a success is that it's multidisciplinary. So it's not the NPA, in other words, only the prosecution that provides services within the Tutuzela Care Center, but we have other role players that are in the center, such as the doctors and the forensic nurse from the Department of Health, such as the police, such as the Department of Social Development. They provide psychosocial services on site. Again, it's a one-stop facility. So you get all your services under one roof. We try and make the system very seamless so that there's victim management and support from the time that the victim enters. We also introduce mutual accountability for us as service providers to ensure that the victim is always at the center. And we've designed objectives that are common and are shared by all stakeholders. So yes, the role we play at the TCC differs, but the ultimate objective is always to ensure that the victim is not subjected to secondary victimization, and it is also to ensure that we get to court with the necessary forensic evidence and that we get the convictions as soon as possible. I'll start at the bottom actually. So what the victim receives is psychosocial, medical, and legal services. It works because of that effective cooperation, collaboration, and communication between all the various stakeholders. which leads to a well-coordinated, high-quality service for survivors, which enables them to move smoothly and quickly through the TCC. Now, the Tutuzelas, our aim, our role is to turn a victim into a survivor. So many people don't want to speak about GBV victims. They say they must be survivors. I'm of the view you need to empower the victim first before you call them a survivor. And so through the TCCs, we are hoping to be able to empower that victim sufficiently so that they can transform into that survivor and be able to go through a court system. All our TCCs are linked to the SAPS FCS unit. So FCS being the, I call them the GBV police, Brigadier Shlalele. They are the specialized unit that deals specifically with GBV matters in South Africa. So it's not your local policeman, it's your specialized policeman who investigate all the cases that come through the TCC. We have a direct link with the hospital because the hospital is where all our TCCs are found, either inside the hospital or on the hospital premises. The reason for that is quite simple. You don't know in what condition your victim will arrive. So if essential, if there are very serious injuries, then obviously we need sometimes more than what we have within the TCC, and so the hospital is right there. And of course the link with the court. So each TCC is linked to the local court that is there. That is wherever the matter will be heard. We have seen an improved conviction rate in TCC matters. So what are TCC matters? These are matters where the cases have come through the TCC. I said at the beginning, we only have 63 in the country, which means a lot of our victims are not going through the TCC. But for those that are going through the TCC, we have seen an improved conviction rate. In 2010, the conviction rate was 60%. Currently, now June 2023, our conviction rate is 76.5% for matters that are going through our TCCs. That is very high. I know, Dr. Green, you are from the UK. In comparison, I know ours looks much better. There's actually one thing we have on the UK then. But I add, these are cases that are going through the TCCs. That's why we need much more of these centers across the country. We've also seen increased long-term and life imprisonment sentences in respect of our TCC matters. And again, I say to the UK here, we are not afraid to give life imprisonment sentences. We have also linked all our TCCs to GBV hotspots. And that has been a game changer. So with the help of the police, every year they provide us a list of where the GBV hotspots are in this country. And so we've made sure that we link all the TCCs to these GBV hotspots. So I think there's only one that we've not been able to link yet, and I think that's Diepsloot in Soweto, but we're working on that one as well. We've also linked it to all the proposed designated sexual offences courts. So I think that will also assist greatly in just making sure that there's that constant link between the TCCs and the courts. And so, yes, ultimately, if you've gone through the TCC, you must have received psychosocial, medical, and legal services. I'm sorry if I might appear a bit rushed. I know that Vanessa is roving around here. So when I spoke about optimal management of GBV cases, I said you need an adequately informed community on issues relating to GBV. So communities must be empowered. They must know their rights. They must know when their rights are being infringed. In order to do that in the GBV, so they need to know what GBV is. They need to know where to seek help. And that's very important, where to seek help. So now you know what GBV is, but do you know where to seek help and how to protect themselves? And so through the Tutuzela Care Centers, our colleagues at the centers, one of their key roles is to empower the communities through community engagement, such as public awareness, through imbizos. So imbizos are really communities coming together with various leaders in the community and discussing these issues. And then also training sessions with NGOs. This is extremely important. You can't work in one environment and the one hand does not know what the other hand is doing or understand what the other hand is doing. So those training sessions become very important. When we have, for example, as we've had in South Africa quite recently, amendments to our GBV legislation, it doesn't help that the prosecutor knows, but the doctor doesn't understand and the social worker doesn't understand. And so it is the task of our colleagues at the TCC to ensure that the training happens both from within the TCC as well as outside to other law enforcement agencies and all other stakeholders. Because the more informed the community is, of course, the more they will be able to access justice. I think, Linda, you spoke about inadequate access when you opened in your opening address this morning. You won't expect access to justice if we don't know what their rights are. And for me, that is very important. And so this is one of the key functions of TCCs. Adequate access to report GBV. I spoke about this earlier, and again, so since 2022, we've collaborated with the police to allow matters to be reported directly at the TCC centers. We've seen an increase, yes, in the number of cases already. It's not yet where we want it to be, but I think that's because there's still a lack of knowledge that you can report at the TCCs, which we're trying to temper through public awareness campaigns and the like. So, and this is what makes it the TCC then that one-stop center, because everything happens under one roof. By the time the victim leaves, she would have received all of the services that is required. And I say she, but it's actually he or she that comes, anyone who is a victim. We do not at all turn away any victim that arrives at the center. And we do know that it's not only women, though they be in the majority, that are victims of GBV. And so TCCs are probably the best display of effective collaboration between all law enforcement agencies, which directly results in the best conviction rates for GBV cases. My one doesn't want to move. There we go. Adequate pretrial services available to the victim. So the TCCs largely embody the pretrial services that are available to victims. These services determine whether your victim becomes a survivor. And as I said, a survivor is someone is able to tell the story in court and ensure a conviction. But it only works if there's collaboration. Now that collaboration, sometimes we whisper the word in the TCCs. It doesn't always work as well. People are coming from different backgrounds, different government departments, different non-government departments. So yes, sometimes there's a bit of strife within the TCCs. But when it works extremely well. And the only persons that profit from it, from us collaborating well, is the victim, essentially. Our pretrial services include trauma containment. It includes medical attention, consultation with a prosecutor, and this is really a key aspect which plays a role in whether there's a conviction or not. One of the most important aspects of optimal management of a GBV matter has to be PGI, prosecutor-guided investigation. In this PGI methodology is practiced in all criminal matters, not just GBV, and it's premised on joint management of the investigation by SAPS and the NPA. It works very well in South Africa. It entails joint target setting around delivery of finalizations and interventions to address challenges. The prosecutor studies the docket, consults with the investigating officer. They look at what is outstanding, the prosecutor will list further investigation, and the investigating officer will try and finalize by an agreed date. There's normally scheduled meetings between the prosecutor and the investigating officer. And in the GBV sphere, this is done by a case manager. So at each TCC, there's a prosecutor that is linked to each and every TCC. These specialist advocates really, and their role is to make sure that there's PGI in all of the dockets that come through the TCCs. This collaboration reduces undue delays in the finalization of our cases, and again, increases the conviction rate. Why does it increase the conviction rate? Many victims don't want the same case in court for the next 4 or 5 years. They lose interest, they move on with their lives, and then don't want to come back to court. So we are hoping that through PGI, we are able to really ensure that the cases do go through, that the cycle times are quite shorter. So what is the TCC experience in 2023? It's become more than a service point. We try and make it a safe space within the community. We are seen as recognizing the needs of those communities where we serve, as they provide clothing. We have care packages and even of late food to our victims at our various TCCs. And this was because of a collaboration with the SPAR group, which is what do they call them, a grocery store in South Africa. We now do referrals to Cape Mental Health, where the need is identified when the victim arrives. We now are able to identify substance abuse if the victim presents and be able to do the necessary referral. Where the need presents, again, referral to a shelter. That is very important because we've broadened the scope now to GBV at our TCCs. We've also introduced the domestic violence protocol, which is very important. So that is where we've trained our TCC staff to be able to assist the victim to apply for a protection order. We are hoping that when we go digital, Yaki, that this will become even, we have legislation that allows us now to do a digital online application for a protection order. So again, many of our victims that present don't have access to do the online. So through the TCCs, we are hoping that we are able to assist, get that protection order to assist the victims, because we also know in our country, many of the victims that present initially as a victim of GBV will later end up in a mortuary as a femicide. So to prevent that, we try and we've rolled out the domestic violence protocol. And we do it even when the victim does not want the protection order or doesn't know about it. We try through the psychosocial services that we provide and through the consultation to make the person aware of what is available and then assist in applying for it. It also operates as a training center, and again, it spreads GBV awareness. More and more our TCCs, we are enhancing the connectivity of our TCCs so that we are able to allow crime trend analysis, because crime trend analysis will allow us to develop interventions to counter results of that particular trend analysis. Each area has its own issues. Whether you're from the Western Cape or whether you're from Limpopo, two completely different provinces. In Limpopo, Yaki, you would be dealing with what? Stock theft, mostly. But but in the Western Cape, you know, we have other issues. So you cannot take what you interventions in the Western Cape and go plonk it in Limpopo. So you need the trend analysis to be done. We've got strong links with the community through our schools, through our NGOs, and we are able to address specific community irritants. Increase accessibility for our victims who are disabled through our collaborations with different organizations and schools to provide, for example, sign language interpreters. And of course, a central point for collaboration between all the major stakeholders in particularly the law enforcement agencies. One of the future projects which we're very proud of is the court audio visual solution, the CAV as we call it, where we are going to be able to assist a complainant, a victim, testify from the TCC and not from the court. So we are saying we're investing in making the TCC a safe space. So why take the victim out of the safe space to go to a court? COVID has taught us that we can now do, what do we call it, digital audio-visual testimony. And so we are hoping to broaden that with our 14 pilot sites so that the victim actually never leaves the TCC but testifies from there, as well as the doctor, as well as the forensic nurse and any of the other persons that are at the TCC, because it means that they don't need to travel. Some of our distances are quite far in this country to travel to a court. And so we are hoping that the court audio-visual solution will be implemented quite shortly. We've also started targeting our new tertiary group, a new vulnerable group, which is the tertiary student. So for the first time since last year, our tertiary student is now also a vulnerable group. And we'll share this presentation, Vanessa, because she's standing there with that tablet that looks more like a gavel than anything else. But I just wanted to say one thing, and it is, yeah. There we go. Okay. So our second best practice is the DNA backlog task team. So again, we know how important DNA is for our court cases. And so in South Africa, we've had a backlog of DNA cases when the police, and in South Africa, it's only the police who have the mandate to do forensic analysis for criminal purposes. And so they experienced the shortage of chemicals, and a backlog developed. And so this obviously would have had a negative impact on the courts and the cases before it. And many of these cases, unfortunately, were all GBV, or many of them were GBF related. And so one of its most important functions of SOCA, of course, is to manage GBV matters optimally. So in a GBV context now, it translates again to adequate forensic resources being available to analyze the collected evidence. So yes, it's not our responsibility as the NPA to make sure that there's adequate resources, but we cannot also fold our arms when there is a backlog, because it has an impact on us, because our cases are not being finalized. So I must be very careful because I've got a lot of police colleagues here. So what we did do is we engaged with our colleagues within the police, and we created a task team with the forensic science laboratory of the police. And so this task team consisted of a nodal point at the police laboratory, and then within the prosecution at head office, we had another nodal point. So how did this happen? What we did is they looked at the backlog, and all the GBV matters were isolated from the backlog, and the analysis was fast-tracked. In addition, we created what we called a priority lane, which allowed our prosecutors countrywide to, through the prosecution nodal point, request special priority in respect of matters. So these are matters that are being in danger of being struck off the roll, or where we would be forced to withdraw the case. Our prosecutor now could simply make the request directly to us, and we would then make it to the forensic science laboratory. And then all these reports, once we receive it at head office, would then be sent to our provinces via email to wherever it is needed, to ensure that we don't have matters that are struck off the roll being withdrawn. In total, this intervention has ensured that in excess of 32,000 reports were received from SAPS as at 12 June 2023. And I must just applaud Brigadier Ras, Brigadier Shlalele, who has been instrumental in getting those reports. And again, this is just another case of collaboration between two stakeholders, because there would have been no success if you didn't have buy-in from the labs, from SAPS. And so there were many meetings held initially as to how this would happen. But that is really, I would think that in any country where there is a backlog, this is the way to go. It works. The number of reports now analyzed have increased as the police resources have also increased, but we've decided to maintain the urgency and emphasis until the entire backlog is depleted. Because of the number of reports we've received, we also required a more user-friendly method for the prosecution. You can imagine how many emails we are receiving from the forensic lab. And so through our IT department, we've now ensured that these reports go onto a server. So wherever you are as a prosecutor in the country, you are able to just simply get your report off the system. Because in South Africa, cases are being withdrawn because the DNA report is not available. But sometimes when we say not available, it's just that the prosecutor doesn't have it. It doesn't mean that the analysis has not been done. And again, it speaks to communication between SAPS, between us and the forensic labs. And so this type of engagement enhances that communication and makes sure that cases are not unnecessarily and unduly delayed, because we're able to ensure that the report is available. And we've been able to then considerably, there's been a reduction in the national backlog of our GBV cases in court. Insights and outcomes. One of the very important outcomes has been a serial rapist project plan. So in sending us all of these reports, they were able to identify potential serials. So that's where there's been hits. And put the cases logged it all together to see whether or not they are, or we are able to identify a serial. Now, just 2 days ago, I actually had a meeting with Brigadier Gwamo around this, and we were able to be provided with the top 10 serials in each of the provinces. So the idea here is that we meet with the police's SECI unit. So SECI is the branch of the police that deals with the serials. And so we will take this big elephant and just bite it bit by bit by starting with the top 10 serials. The knowns, because you've got the knowns and the unknowns. So with the knowns, where the DNA link has identified a perpetrator, we are going to prioritize these matters, because we believe, once again, if we get convictions in these big serial matters, you take care of a lot of cases all in one foul swoop. And if anything, it will enhance credibility in the criminal justice system. Because I've looked at some of the top 10, some of these guys have been operating for a long time. And they move across the country. So instead of doing piecemeal prosecutions, we are saying, let's centralize these documents into one jurisdiction and prosecute immediately. DNA evidence has been accepted as conclusive in this country by our courts for many, many years. And so we are hoping that, as in the UK, they will come and plead guilty so that we don't have a long, drawn-out case. So we are quite happy that this has been one of the most important, I think, outcomes of this collaboration and of this task team. We've also been able to, and we have our own research team within the NPA, now doing an analysis of the data that has been collected to look at where are the most serials operative. What modus is being employed? Why do they remain undetected for so long? If enrolled previously, why was the matter, why did they not proceed with the matter? And so this information will inform interventions made at provincial level. Another important outcome is we've sort of restarted the cold case murder projects again. Again, in South Africa, we've got a lot of cold cases. I know that the police used to have a cold case task team. I'm not sure if they're still operating. We are hoping that, again, because we've actually extended, my apologies, that slide should actually have been, it should actually be that 1 August last year, we started to do the same process with murders. In other words, we expanded the task team now to not only deal with the GBVF matters, but to deal with murders in general. And that's how we've been able to pick up a lot of cold cases where DNA is outstanding, murder cases where DNA is outstanding. And they also form part of the general backlog. So they will be prioritized in exactly the same way as we've done with the GBVF matters. And as I said, the serial matters identified, I'm hoping, Vanessa, that if you do invite me again, we'll be able to tell you these are how many serials we've been able to bring to book. There's also been a lot of learning opportunities, Colonel Otto. What we found is from the DNA reports that we've received, there's a high number of DNA samples which couldn't be analyzed because of insufficient sample collection, for example. High number of DNA incorrectly corrected, therefore of no evidentiary value. High number of samples correctly collected but incorrectly stored, therefore also of no evidentiary value. And these are areas where common mistakes were made, identified, and the necessary interventions can be made in collaboration, again, with each other. So in conclusion, implementation of these two best practices have proven effective to effectively address the need for optimal management of GBV matters, but its success lay in committed, continued implementation, but also periodical analysis of its challenges and outcomes. I thank you.